Yeah, thanks. So Vish, just in light of the questions about sort of modeling types, I was gonna, and some questions about the role of qualitative as well as quantitative components of this. I wanted to give a glimpse of three types of modeling that we often use within the system science area, in part because they inform understanding of different types, different sub-areas of sort of complex systems, and in part because they're increasingly being combined, and they each have sort of limitations. So let's take a look at a few of these. I'm going to have to triage as I have been. So we talked about how in this area, Vish asked me to talk about disparities. We're positing that a lot of the things we see in the world, the statistical data that we collect about this or about that, they're resulting from some underlying processes in the world. And these processes are often tightly interrelated and causally tangled. So we think about the burden of poor oral health among the poor, and you see a tangling together of issues having to do with service delivery and access and affordability on the one hand, with issues having to do with trust issues and time and availability issues, with issues having to do with behavioral habits, with behavioral risk factors and protective behaviors, with the processes, the service processes that go on within a given practice. And the persistence of disparities reflects these underlying processes. And to really understand these patterns of disparities, and to understand why they resist best efforts to correct them, housing vouchers and efforts to reform the welfare system, et cetera, to understand why they've exhibited such, as we say, policy resistance. We need to think consistently about the processes giving rise to the thought. The thought is that if we don't do that, we'll be risking working at cross purposes with the nature of things. And the example I like in Canute here, who tried to order back the tide, or so the story was, in medieval England. He was actually a skeptic. His advisors told him, you're the king of everything. You can dictate any aspect within your lands. And he said, well, look, I can't control the tide, right? And so it is with a lot of our work. We're sometimes working at cross purposes with the nature of things. We're butting our heads against the way things are. And so for this reason, we turn to system science, this sort of science as a whole. And a key role here is the role of dynamic modeling. It's not the only role. It turns out that there's this whole area of systems thinking that I'll give a nod to, which involves consciously, purposefully, and reliably sort of broader ways of conceptualizing issues that can get us out of the trap of stovepiping, of sort of thinking about one main line of effect and the other things as just side effects we could ignore. But dynamic models are central to sort of discourse in these areas. And at some level, whether they're more fully articulated or just sketched out, they inform most systems thinking. So we're going to be talking about some aspects of these models, and I'd point to Josh Epstein's work, and I've provided you links to it on the site, this generative perspective. He argues in this generative manifesto, we don't truly understand something. We don't truly understand health disparities until we can generate it without presupposing it, until we can see how it results from the system without presupposing it. So I'm going to be talking here about three major types of modeling, of dynamic modeling: system dynamics, agent-based, and discrete event, and offering a few words on sort of hybridization. So I'm not going to have time to do an interactive example here, but we've talked about dynamic models as representing hypothesized causal relationships. Here are some of the types of uses people have suggested. Again, just a subset of dozens. But one thing you often find people gravitating these for is what-if tools to identify policies that are cost-effective, that are high leverage, that are robust given uncertainties about about things outside of our control. To evaluate the benefits of restructuring a system, like we're doing up north of the border. To understand trends and make sense of interactions of diverse information. Why are we seeing this trend? Is it a good thing or a bad thing? We published a paper some years back using a model to sort of query whether certain data that was being heralded as a crisis involving rates of chlamydia was instead possibly a sign of progress in terms of finding unrecognized cases. Maybe it was draining the swamp. The higher number of cases was indicative that we're doing a better job finding them rather than leaving them latent. Models can be used to sort of put other lenses on things and explain trends. They can be used to prioritize research and data collection. They can be used to sort of say, this one piece of data has a disproportionate impact on, whether we should be as an intervention. It could have a huge impact on how our ability to quantify the outcomes of some policy. We put effort into data collection. We've done this in our work. One case, we've paid $12,000 to go collect some data from our administrative data, province-wide data, which will be a key input into that we know the model is really sensitive to in understanding outcome potential policies. And then to understand classes of context with certain strategies that are useful. Suppose you have a strategy which works really well in Los Angeles. To what degree does it translate to to New York, or translate to Boston? Models can be very useful for understanding this. Okay, we got the basic components of the model. Let's talk about each of these types. So, if you go to the literature, you'll find no shortage of people talking about each of the three types of modeling. Huge literature on discrete event modeling. Absolutely gigantic literature. It's been used for decades to examine the impact of health service delivery. Things like emergency departments. I think one recent literature review found 1,300 models of emergency departments out there. The flow of patients in emergency departments and how their flow is constrained by availability of nurses and beds and doctors and diagnostic equipment, et cetera. In other cases, system dynamics models, you'll find out they're agent-based. How do these types differ? Well, at a surface level, they differ in terms of how they describe the processes in the world, how they describe what's going on out there, how it's posited to work. And even more so at a superficial level, visual representation of the software features. But at a more fundamental level, the differences have to do with the purpose of the model, what they're being used to investigate, the nature of the problems they're trying to address, how they frame the problems, and the focus of the analysis. One point of caution here, it's very rare to find people out there who've applied multiple methodologies. By and large, if you go into systems science area and you meet practitioners, they're people with one tool that works quite well, and they'll use it in many, many, many different cases. If you're going to seek advice about trade-offs, try to talk with someone who's applied all techniques, or at least the several techniques you're considering reliably. So let's talk about system dynamics. So what is system dynamics? It's a feedback-oriented perspective. It focuses on feedbacks and accumulations of a system. Whoa, those are big terms, fancy terms, abstract terms. Try to nail them down in a bit. It's an evolving methodology to help conceptualize how we understand, describe, to characterize at a quantitative level. Conceptualize is more sort of mapping it out at a qualitative level. Describe is sort of specify it quantitatively, analyze, and manage feedback systems. Okay. It originated over 50 years ago in the work of Jay Forrester at the Sloan School of Management at MIT, and MIT is still at the center of system dynamics world. I was fortunate enough to have gotten my exposure to system dynamics there. Now, one of the things that's really interesting with system dynamics is it has a really big emphasis on qualitative components. This is in contrast to the other two types of modeling, where this has really been downplayed, where really the focus is on getting the model that will give the results. System dynamics is more about the modeling process and about the qualitative side of it, and I think it's to its strength. I speak as someone who's applied all of these techniques and uses all of them in an ongoing way. It's a defined incremental and iterative modeling process that delivers value from the start. It tries to deliver value from the very start of the modeling process. And it really interestingly has time-honed techniques for work with stakeholders in a participatory fashion. So you often find system dynamics being practiced in organizations or communities in a way that gives voice to the members of the community because the models are simple enough that people with very little background or no background previously to this session can give feedback on the model, can give input into the model. It does rigorous mathematical foundation, which turns out for those with the right training can open up a whole set of analysis opportunities. And it has some really evolved simple software for you. Perhaps, though, the most distinguishing feature of system science is the fact that it really focuses on shaping people's mental model, how people think about the system. Its purpose in many ways is to bend not just the curve of outcomes for a policy, but to bend how people conceptualize the system so they think more consistently about it. And the idea that it brings to bear is that policy resistance, this failure of our policies, is in many cases the result of narrow mental models. We have too narrow a model. We think we're going to introduce low-tar cigarettes and they're going to help improve smoker health. They're going to lower the carcinogens for the smokers. And we ignore the side effects on quitting. We say we're going to put in place low-nicotine cigarettes to get people less addicted. And we ignore the side effects in our thinking on how deeply people will smoke, or how fully they'll smoke a cigarette, how extensively, or how many cigarettes they'll smoke a day. We decide we're going to put into place, some sort of intervention for lowering drug resistance, and we find ourselves stirring up another sort of generation of drug-resistant bugs. So it's aspiring explicitly to broaden sort of mental models, how we think about it. And I have various examples of mental models here. So you remember this picture. Now, I'd like to highlight some features. This is an example of a qualitative system dynamics diagram. And this, forgive me, it has to do with susceptibles, infectives, recovered. But basically, it's dealing with, this is what's called a causal loop diagram. And here, it's what I would call a semi-quantitative or mostly qualitative way of depicting a system. We have variables posited to be operating out there in the situation, and we connect them with arrows indicating positive causal influence. So the more susceptibles there are, the more contacts there are between susceptibles and infectives. I have a diagram of this sort I really, in retrospect, I should have included here, which has to do with infant and child mental health and the interaction with the caregiver. And it's an interesting example of where you can sketch out a diagram showing the links between various factors quite readily, and where someone with very little training can sort of start to put together a diagram like this. But a couple of features are notable. These linkages are associated with a polarity, plus or minus. If there's a plus, if you have an arrow from A to B, it indicates all other things being equal, an increase in A, say here the number of susceptibles, will tend to increase B, the number of contacts between susceptible and infectives, compared to the value it otherwise would have had. So, crudely and very simplistically, we'll say if A goes up, B goes up. Susceptibles go up, contacts go up between susceptibles and infectives, all other things being equal. A minus, say between new infections and susceptibles, indicate it goes between A and B. It would indicate if A goes up, B goes down, all other things being equal. So if the number of new infections goes up, it tends to reduce susceptibles that remain. So here, on the basis of these links, we can actually deduce what are called feedbacks. The presence of these loops in the diagram are indicative of a feedback, and we label that feedback with a polarity, which can be obtained, whose sign can be obtained by multiplying the signs using the classic rule sign. So positive times a positive times a negative is a negative. So this is called a balancing loop. It's a loop where if you increase A, say susceptibles, it leads to a set of changes that ripple around It increases the contacts between susceptible and infected. It increases the number of new infections, which tends to push back against, it tends to decrease the number of susceptibles. So in a negative feedback loop, a balancing loop, an original change in one direction leads to a set of changes that rip around and push back against that original change. It sort of pushes back. It's kind of like you grow hungry, and as a result, you're more likely to go get food and lessen your hunger. And we have, it goes without saying that at a biomedical level within our bodies, there's, I believe, dozens of these regulatory loops for salts, for thermal regulation, for eating, and for thirst, and you could go on and list them. But fundamentally, these are regulatory loops. They sort of keep the system in balance. Not always a good balance, but a balance that's hard to disturb. It resists. It can be policy resistance associated with this. By contrast, there are positive loops, or loops labeled with a positive sign, which indicate reinforcing feedbacks. These are feedbacks where we sometimes use the term vicious cycle. So let's trace one of those. There's one here in terms of this one involving contacts between susceptible and infectives, leads to more new infections, which leads to more latently infective individuals, and individuals eventually completing latency and therefore more infectives. This is a list with a vicious cycle of infection breeds infection. You have more and more people getting infected over time. So in these diagrams, what we have is we have competing loops. And mathematically, you can actually analyze that. These sort of loops, these positive feedbacks tend to lead to instability, rapid takeoff. Think of an outbreak doubling from one person infected to 2 to 4 to 8 to 16. Meanwhile, these regulatory loops tend to balance things. They tend to limit those growth. And so when we conceptualize the system in terms of feedbacks, as system dynamics tries to do, we sort of are reasoning about the impacts of these feedbacks. Why do we feedbacks? Well, it turns out that they have a disproportionate impact, a huge impact in shaping the behavior of systems. If you have a positive feedback or a negative feedback, it tends to bend behavior profoundly. But the idea is by analyzing those feedbacks, we can better understand how the system behaves. But there's some other components to system dynamics too, and that's accumulation, ladies and gentlemen. This idea that systems evolve not just feedbacks, but accumulations over time. And we talk in system dynamics about the stocks of a system. So here we have a stock of susceptible, exposed, infective, and recovered individuals. These represent kind of the current state of the system, the count of people who are susceptible, the count who are exposed, the count of infective, the count of recovered people. Importantly, it's a cross-sectional depiction. We're depicting sort of the number who are exposed at a given time, the number infective, number recovered. Even though there may be individuals out there in the world who are getting exposed many times, getting infected and going back and forth here, think about someone who gets flu every year. We can't really articulate the question. We can't really answer in general the question, is it the same person who's here now who's there before? Just a number. It's a cross-sectional depiction. So these stocks are shown in boxes, and those represent accumulations. You could think of them as kind of representing the current state of the system, a certain number susceptible, certain number exposed, certain number effective, certain number recovered, and over time it will change by individuals going down these flows, heading down from one stock to the other. So individuals, for example, getting infected, going from susceptible to exposed, the person will be decremented from here. It's no longer 1,000 persons susceptible, it's 999, and there'll be a second person exposed, so move over to the exposed state. So these stocks are sort of capture the state of the system. They can be measured at a certain instant in time, and they can only be changed by flows into and out of them. The changes of the system, kind of the verbs of the stocks are kind of the nouns of the system. The verbs are these flows between stocks. And these things are always measured per unit time. So, we think of the prevalent cases for diabetes, say. That's a stock. It's a certain number of people we could quantify right now. By contrast, the number of incident cases, if I said, we have 300 incident cases in Saskatoon of diabetes, you'd say, Saskatoon, what? Oh, well, after that, you would say, well, okay, 300 like in a day or a week or a month, it matters, right? If you're talking about incidents, you're talking about cases over time, you need to mention it's some amount over time. And so it is with flows. So if we're dealing with admissions to a hospital, or if we're dealing with number of people recovering, or number of people whose immunity has waned, we're dealing with numbers per unit time. If we're dealing with new costs born, you're saying new cost per month or per year. That's a flow. It's a sign it's a flow. Accumulated costs to this point, accumulated quality-adjusted life years, that is a stock. So we distinguish between flows and stocks. And given the time and the fact that I want to cover all three of these techniques, I regret I'm not going to be able to go in more detail, but I'm happy to talk about this more. You'll also find various lectures of me online in YouTube where I'm talking about this and all the other modeling methodologies, and probably using more examples of it than you want to see. So here, stocks determine flows. How many people right now have prediabetes shapes how many people may be developing diabetes in the next little bit of time. If we have 1 million people with prediabetes, we're going to be likely having more people developing diabetes than if we have 0 people having prediabetes. The stock shapes the flow, and similarly, the flows dictate changes in stocks. So in the system dynamics model, you have this duality, this interaction between stocks on the one hand, the rectangles and the flows shown as the linkages between stocks. Okay. Now the typical way, if we're dealing with disparities, ladies and gentlemen, front and center is heterogeneity. Front and center is this issue. We have some people who have more adverse outcomes than others, for example, or some individuals who have greater access to care than others, or greater access in terms of social determinants of health. And the way we capture it typically in a system dynamics diagram is what's called stratification. Conceptually, we subscript these things. So we have a number of susceptible men and a number of susceptible women. Maybe we're dealing with gonorrhea. Or we have individuals who have prediabetes of different ethnicities. We capture it by sort of saying, okay, there's pre-diabetic whites, there's pre-diabetic Hispanics, pre-diabetic African Americans. We stratify the model in that sort of way and capture heterogeneity through this sort of stratification. There's a real challenge here when we deal with health disparities and social determinants. There's a real disparity because there's an explosion in the number of categories as you consider not just ethnicity, but age and income and education levels and maybe their birth weight or what have you. You're talking about a larger and larger number of subscripts, and it gets pretty awkward, actually. That's not system dynamics forte. System dynamics tends to do pretty well with more homogeneous populations, and adding a new type of heterogeneity in a model requires model-wide changes. So it's not that flexible for it. So, for example, here we could introduce into our model some different assumptions about the number of contacts per unit time that a given individual will have by subscripting that for different subpopulations, low SES and high SES populations. And we see different results for each of these. If we wanted to see transfer effects of an intervention, we could see how it affects the low SES and how it affects the high SES. Okay? Now, system dynamics models, like all types of models, all types of dynamic models exhibit emergent behavior. We get surprised by model results. We see things that we didn't expect coming out of the model because of the nonlinearity and the complex interactions of various factors. We see outcomes that we wouldn't have anticipated in our head. And this is the value of these models, right? They help add things up in a more consistent way than we can in our head, and sometimes we're surprised. We say, wow, we didn't expect that. We didn't expect this intervention to be twice as effective as this other one, or, to take 3 times as long to show an effect. That wasn't something we expected. And sometimes we got tipping points, cases where, we invest enough in vaccination and boom, the situation markedly changes. This scourge of thousands of years of children, measles, mumps, chickenpox, pertussis, rubella, suddenly it becomes a minor issue until the negative feedback associated with people getting complacent. People saying, well, measles, what sort of danger is that? I haven't seen anyone get measles my entire life. Why do I need to protect my kid? Why do I have to inject him? Have the government inject him with a needle? What danger is there of measles? And people get complacent, and that's a regulatory loop. That's people getting complacent and therefore less likely to adhere to behavior. In any case, tipping points, lock and effect, things can be explained in dynamics models. And unfortunately, I don't have time to go into them in details. There's a fascinating area of formal analysis of these models that's mathematical in character. So what is system dynamics sort of strengths? Well, it allows for really rapid model prototyping. It's participatory modeling in a very powerful way. And this is incredibly interesting how it gets used with communities to build up models.
Can you give an example of the participatory?
Yeah, sure. I thought I had some slides here on it. Let me just see. So the person whose work I like to cite the most here, whose work I'm deeply impressed by, is Peter Hoffman, and I had actually some slides on this, which I'd love to expose, but maybe I stripped them out. Okay. Okay. Yeah.
Since you sent them, I can share.
Yeah, I'll put some there. But the basic idea is this. So do you remember those? Do you remember this causal loop diagram that I showed? Let me get it back up here. This is this one with these loops and these arrows and these polarities. Remember that? Okay. Yeah, did I pass it? Okay. Thank you. Here we go. Hey, help me. Oh, okay. Come on. There we are. Okay. This diagram is indicative of one way of the types of artifacts that are sometimes used during participatory modeling. So Peter has done participatory modeling worldwide. So he's had some fascinating projects, for example, involving development work in Mongolia and India, in rural India. And he tells the story about basically what happens in these participatory modeling projects is they'll go into a village and they'll engage with groups within the village about some issue. And they will construct interactively with these people a map. We call this a model map sometimes, sort of that maps out how various factors are related within the village context. Because, you go into a village and maybe your ostensible reason for going there is because water supplies are drying up. Once you really talk with them, what you find is, okay, water supplies drying up are a piece of the system due to a bunch of causally tangled factors involving the shift to a new type of agriculture, the presence of imported cows, the fact that a lot of the vegetation has now been denuded, and so the water runs down, the slopes in a way it used to sink in, and you can go on. And the people in the village basically work with this modeling team to articulate factors for their village in a causal loop diagram sort of way. And the story Peter tells that's very powerful is he has these photos, which I weave into a discussion of this in some other of my presentations, where he's about how he actually has a photo of them building a diagram like this on a board in the local language, and there's a translator there and so on. And there's a woman coming in and pointing at the board. And what he says happened is the group they were dealing with was a male group of about, I'd say, judging by the photos, 10 to 15 people. And they were talking about this, and it laid out this diagram. And this woman came in during the discussion to, I think, tell something to one of the men. And she stood there, and she looked at what was going on, and she was there for maybe 15 minutes. And then she said, "You've forgotten something." And she walked up to the board and said, "You forgot, you need to connect this to this, and you need to add this other factor that's missing from your diagram because, you've neglected to note how, I don't remember what it is, how, chopping things wood has forced us to go further away, and therefore there's been less time for us to man the pumps," or whatever it is. And she was able to actually engage with this diagram, parse it, understand it, contribute to it with no training. And that's the sort of thing that you can get in these participatory sessions. So what happens is they build up maybe a diagram like this, but sometimes they actually build up this sort of diagram. And Peter has these great examples, city schools and St. Louis, where they've gone in and they've said, okay, let's talk about bullying in your school. Let's understand the factors that lead to bullying. And so they've tried to map out in a qualitative way sort of the, using a stock and flow diagram, sort of factors related to bullying. And the idea is, in many ways, partially to understand what's going on, but it's partially to understand their perception of what's going on and offer it. It's not just to privilege what they say is going on always. It's to sort of recognize that there's a value to eliciting this narrative. And although I don't have the relevant slides for it here, what I'll say is that this sort of participatory modeling, it has many benefits. One of them is you get a better understanding of their understanding of what the situation is. You get sometimes a better understanding of the details of the situation than you'd get otherwise, say through a survey or what have you. But importantly, you give them a voice. So there's kind of this dignity, he talks to dignity of risk. That, look, if you're talking about interventions that are going to affect this community, give them a voice in the whole thing. Give them a way of sort of speaking up, of having their voice heard. He also talks about the role in which, people feel part of the process. They're more likely to feel a sense of ownership over the model that results. They're more likely to feel vested in the process, more likely to want to help out. So this participatory modeling opens doors for sort of types of change that are more inclusive than a modeling built by technocrats. And this is, I think, as a self-critique and someone who does most of my time doing agent-based modeling these days, done a huge amount of system dynamics and a fair bit of discrete event, but as someone who spends most of my time doing agent-based, I have to say, the agent-based community has particularly been more technocratic. We will build the model for you, and we will show it to you, and we'll use it to give you good advice. And that's not a very that's not nearly as effective a strategy as it can be if you involve the community in part of it. So in our agent-based modeling work, we actually build agent-based models interactively with stakeholders. That's a lot of our work, is sort of doing this interactively. And we've done it quite extensively, having the main modeler work alongside and embedded in teams of non-experts who then get to interact with the model, run it, modify it, interrogate it, and interact with it. So that's a bit on the participatory components of that. Let's maybe talk about agent-based models. So what is agent-based model? This is the buzzing, blooming confusion, and maybe you're still blooming from it. So here we're dealing with one or more populations composed of individual agents. We're depicting individuals. We're not just counting the number of individuals who are susceptible or infected. We're actually we're individuating people in the model, say. Might not be people. They might be clinics. They might be organizations. They might be some representation of medical staff of various sorts. Each of these agents is associated with some parameters, their age, their sex, perhaps, or their ethnicity, their socioeconomic status, what have you. Not age. Age is an aspect of state. They have some state. They have some evolving sort of status or situation which is changing over time. Maybe it's their smoking status, the networks in which they're embedded, which evolve over time, their preferences, maybe it's their age. There's rules for evolving the state. We saw that in the form of that state chart. Do you remember I showed, there was someone who was a never smoker, kind of former, and there were these things that said cessation and relapse. Those are sort of rules for evolving state. If we had looked at those more closely, we would have seen that they were governed by a variety of factors, including the number of neighbors they had who were smokers. And then critically, and this distinguishes it from microsimulation model as practiced many years back, there's a way of interacting with agents, a way of interacting with other agents and with the environment. Oh, this sounds terrible. I mean, it sounds very abstract, but basically, people are embedded in networks, and they can interact with the networks. They can influence each other over the networks. They could infect another one, or they could share needles with another one, or they could change the norms of another one, or they could interact agonistically with another one, or they could shape the knowledge, attitudes, and beliefs of this other one. They could yield an exposure of the other one. Person A is smoking, and the other person sees that and reacts to it. So they have some means of interacting with other agents or with the environment itself. Maybe they're exposed to poor walkability in the environment. I haven't shown you, I'd love to show you if I had more time, GIS embedded models of agents. So you have agents circulating within a neighborhood, and they're exposed to the walkability of that neighborhood, or circulating in an area with a certain number of parks, and they're exposed to the availability of recreational spaces, or to advertising situated geographically. So we can embed people in an environment that affects them and where they can affect the neighborhood. In some cases, they may end up leaving a mark of some sort in the neighborhood. So this model is time horizon and characteristics, whether it's stepped over time or less continuous time, and in some initial state. So in system dynamics, doesn't come out well in the PowerPoint, but basically in system dynamics, we have this set of stocks, right? These stocks, and we basically organize the model according to state, according to person's state, whether they're exposed. Count the number of people that are exposed. Count the number that are affected. And so the data is the number of people with that characteristic, and we organize the model according to state. In an agent-based model, we organize the model according to individuals, and for each one, the data we keep track of is what states they're in and their characteristics. So this is a difference with system dynamics and agent-based. And agent-based models tend to be far, far easier to introduce heterogeneity into them. Forgive the lack of Queen's English. It's far easier to introduce heterogeneity into an agent-based model. Adding another aspect of heterogeneity, say someone's education level, it's a matter of simply having that individual keep track of another bit of information. In a system dynamics model, it would double the model size. So these are aspects of parameters that we'd associate with each person in a population. So each person here would have a certain ethnicity, sex, and income in this population. Each person would be associated with state. We saw this before, these sort of state charts. And we might have multiple state charts. Persons in exactly one state with respect to infection, one state with respect to care seeking, or one state with respect to knowledge, attitudes, beliefs, with respect to vaccination, or what have you. And then means of interaction. So networks, for example. Now, very importantly, system dynamics, we see emergent behavior over time. We see unexpected oscillations, or we see tipping points where suddenly behavior changes from an infection circulating to it dying out for two different scenarios. With agent-based modeling, what we see is phenomena not only at the level over time, but we see patterns over space, over networks. This is a model actually here of different species. These are deer. We're looking at a prion-based disease in my fair province. So these are mule deer, of which you folks are innocent. But these are individual deer, and they come into contact with each other. But more to the point, they shed prions in the environment. They shed these types of misfold proteins which can infect other deer. This happens to be related to deer, but I would argue, with no disrespect for the individuals involved, that within our healthcare system, there's a lot of shedding that goes on of MRSA, for example, and various surfaces within healthcare facilities. There's a contamination that comes about due to drug-resistant bugs or what have you that live on surfaces. And you can capture that in an emergent way within this sort of modeling quite readily. Okay. In contrast to system dynamics models, agent-based models are stochastic. System dynamics models are deterministic. So if we run it with a certain set of assumptions, we get out exactly the same results. With agent-based modeling, you actually get out distributions associated with outcomes for a given point in time. You have to run it again and again and again in what we call a Monte Carlo ensemble But basically, there's stochastics involved. There's uncertainties about the vagaries of exactly when someone initiates or when they quit or what have you. And these stochastics are assets. Yes, they take more time. Yes, these models require more computational burden to simulate. But it turns out that sometimes you look at data from the real world. I don't know, you folks have looked at a lot of data from the real world in your time. Have you ever noticed the data is not always pretty? You've kind of jagged patterns. And we use agent-based models, even if we're not leading a modeling project. We have a number of papers in Canada looking at administrative data over a quarter century, population-wide for diabetes, for example. And sometimes we see patterns in that data that are sort of hard to interpret. And, for example, we see overall rising patterns, but we see a number of years where it comes down precipitously, and then it rises again. And we've used agent-based models, actually, to explain why we see those patterns and for particular statistics. For example, age-specific statistics. It turns out that you almost inevitably see those patterns because a big group comes into a larger group comes into the, say, 10 to 14-year-old age range. The numbers go up in that age range, and then as the night will follow the day, that group leaves the 10 to 14 years later and will go down precisely. So the point is that we can use stochastics from these models to reason about the patterns that we see in real-world data to understand them better. So here, a particular run of this model will yield particular curves. We saw that in the first few minutes of this session. But typically, you're going to be running this model many, many times, and you're going to see distributions out. So here, we have time here, but at a given time, there's actually a distribution. And if you were to cut this, unfortunately, the colors don't always come through well here. But if you were to cut it, you'd find a distribution here. It's a 2D histogram. There's kind of a smaller number here, and then it rises and then goes down. And so you see actually a distribution. You could see it illustrated over here. A given run yields a certain number of low SES cases, a certain number of high SES cases, but if you run it many times, you'll see a distribution of each. And it's not always unimodal. You'll see, sometimes there are none at all, for example. Very important goal in the health disparities context, or very important use for these models is to capture multiple levels of scale. Some of you may be familiar with multi-level modeling. I don't know if you've encountered that before. Hierarchical linear modeling, structural equation modeling, models that characterize things, mixed effects models, that characterize things at multiple levels. So you have effects that operate an individual person, a neighborhood, a school, a municipality, a country. And you might want to correct for, the fact that there are school-wide factors, but there's also individual variation within a school. And it turns out that you can capture these multiple scales within an agent-based model very straightforwardly. So you can have, forgive the crudeness of this, but you can have individual cities arranged in a network, and each city can have networks within it, within which there's influence applying within the city. So notable strengths of ABMs, they can capture continuous and discrete heterogeneity, things like people's history over time, things like their age, their sex, continuous things like birth weight, what have you. And you can capture targeted interventions that target particular subgroups of the population, and transfer effects, things that affect one group at the expense of another. You can represent networks, spatial context, multi-level nesting, situated decision-making by agents, localized decision-making based on their particular social network and learning, aspects of their longitudinal behavior that might shape whether they're eligible for an intervention or not, whether they have a certain history, and we can characterize the intervention effects, for example, on individuals in a more sort of fine-grained sort of way than is often possible in a system dynamics model. The final type I'll just mention here, so we have to close, is the issue of discrete event modeling. This sort of modeling is normally used in the context of care processes. It's process-centric modeling. It has to do with a workflow that's defined, that can be mapped out, in a fairly ready way. You go into the emergency room, what happens? There's a set of processes. You go through the triage nurse. They decide if you should be discharged or if you should wait or if you should be admitted immediately. And there's a set of processes. This sort of modeling, which is workflow-driven and resource-constrained. In other words, what happens depends. How long you wait depends on the ability of a doctor or a bed, a piece of diagnostic equipment, or a nurse. These sorts of contexts, we use what's called discrete event modeling. Notable features of our queues, which are waiting lists, processes that operate on these individuals flowing through the system. Think about patients, for example, and you map it out with flow charts. This sort of modeling is very powerful to crisply represent context or a flow of individuals in the context of limited resources. Maybe it's limited resources, limited number of doses of vaccine, or maybe it's limited resources in terms of number of counselors to provide behavioral counseling to an individual, or maybe it's waiting times for infant and child mental health appointments, or what have you. And here you're using these models typically to identify the impact on particularly health service delivery, throughput, or waiting times. How long you have to spend in the facility before you get treated, how many patients they can see per day, based on the level of resourcing, how many docs, how many nurses, et cetera, resource coordination, placement of resources in facility layout. And this sort of modeling can be done quite readily by those with a limited amount of skill. What I will say is that within this area, what we're seeing increasingly and what we've been really advancing our work is hybrid strategies. 10 years ago, I would have stirred you before and would have talked potentially about which technique to use for your problem. And that gets you a certain distance. But increasingly today, what we're talking about is weaving them together. What you have is you have the agent-based model, say, which represents the population out there, their social support networks, their dyadic relationships with informal caregivers, the person who's helping to take care of that person with dementia. And then when that person comes in for care, for formal care, because of an infection or what have you, they go through a care process that's modeled with discrete event modeling. That's an example of one hybrid situation. Or you have system dynamics capturing some of the dynamics within an individual that's more continuous in nature, say buildup of stress on the part of an individual and decline of that stress. But they're in an agent which is in networks which provides social stressors to that agent. So here, increasingly, we are combining together, for example, agent-based modeling and system dynamics with either ABMs within system dynamics or system ABMs, or ABMs and discrete event simulation to capture catchment basins for facilities. So, for example, a model which we're building with Neil Helfand's group, which Robin Flint is leading there, you have individual agents in the population. They present care at a dental clinic, and they flow through it according to a discrete event modeling, are treated. Their conditions may or may not be successfully resolved. They may get behavioral counseling, which may or may not change their underlying behavior, and then they go back home with their teeth fixed and hopefully their behavior adjusted as well with fluoride treatments, et cetera. So here we combine multiple sorts of modeling to gain combined insight. And that, ladies and gentlemen, is all I have time to give in terms of prepared remarks today.
Thank you.